I'm Dr. Pete Miller from Iredell Neurospine, and I wanted to talk to you today about minimally invasive spine surgery. In the last few years, there's been a number of really incredible innovations, and I wanted to bring you up to date on things that we're able to offer now for patients. We now have available in the operating room things like CAT scanners that can follow our every move and show exactly where we are in someone's spine, and so that helps us make spine surgery much safer, and it also allows us to do a more targeted operation where we can go exactly where we need to go without having to do a large big opening. We're actually able to put a tube down and successively move the muscle apart so that we're going between the muscle fibers. When you do a more open procedure, that oftentimes will damage the muscle, and so there's a lot more pain involved, there's a greater risk of infection, and your recovery takes longer. So the minimally invasive spine surgery actually gives us a chance to help the patient do the same exact things, but do it through smaller incisions so that it's less disruptive to the tissue. Over the last few years, I've increased the amount of cases that I do with minimally invasive techniques to about 90 to 95% of my practice. That's how important I think these techniques are, and they've really shown a benefit for our patients. In the open procedures, what we used to do, this is looking at a spine here, and you can see this is the muscle that goes along the side. Ordinarily, this muscle runs up on both sides like this, but what we have to do for a spine operation in the open technique is, depending on what we're doing, if let's say we're doing a decompression, which means clearing out bone spurs, what we do is we make an incision that may be about that long, sometimes longer, and then go in there, and we usually either use a tool that looks something like this, or we can use an electrocautery which actually burns the muscle off, and literally what we're doing is stripping the muscle off on the sides to clear off the bone. So you can imagine what that does is it damages the muscle. Now, most of the muscle comes around, but we've also seen in studies that sometimes the muscle doesn't come back as it should, and you get what's called atrophy, where the muscle literally kind of dies off over time, and that causes long-term problems like back pain. In an open procedure, then, what we would do is strip the muscle off and then cut the bone off on both sides for, say, if we're doing a decompression, to clear out around the nerves. Now, what we can do instead with minimally invasive techniques is we use a CAT scanner in the operating room, and it has an array of cameras that can see any instrument that I am holding in my hand. So for instance, we call this a turkey foot, and what it is it's just basically a wand that I can touch anywhere on a spine and show exactly, it shows me in 3D on the patient's spine real time exactly where I'm at. So how it does that, the camera sees these 5 balls here, and it knows if I'm turning it a certain way, the computer can calculate exactly where it is in relation to where the patient is. What that allows me to do then is I can do an operation through a tube. I can put the tube exactly where I need to go, and then do the operation through the tube, and then take the tube out, the muscle comes back to its normal position. So it causes much less damage. How we do that is we start out, and again, we have a thing like a wand. I'll just put this down, and I'm watching 3D on the camera as it's going. I can see exactly where it's going, and then I put it down to the area I want to, let's say, decompress, clear out around the nerves. Then we take this part off, and then I progressively put larger tubes over this, and what that does then is it dilates the muscle, it spreads the muscle apart so that we're going between the muscle fibers rather than stripping them off and damaging it. And so this is how it works. We just put it down, we put down the tubes down into the area like this, and then we have a final tube that we do the operation through, and so we just put that down there. As I'm doing the operation through an opening that's about as big as a nickel, maybe a little bit less than a nickel in terms of its diameter. So rather than doing an operation where we're stripping the muscle off completely on both sides, then I can go in between the muscle to do the operation. So then what I do is I take these all out, and then we secure this to the table so that it doesn't move, and then through magnification, either some people use microscopes or you can use special loupes, which are magnifiers on your glasses. You can do the operation through the tube, gets done what's need to be done, and then the other nice thing about this is if we're doing a decompression, what I can then do is actually angle the tube and clear out underneath the bone so that the muscle on this side we don't even have to touch at all. We can get a CAT scan and check our work to make sure that everything we intended to do got done and that you don't even wake up until we're sure everything is perfect. Patients can come in and get, say, several levels decompression, which ordinarily you'd be in the hospital for 3 to 4 days afterwards recovering from that. They go home the same day.